CEO, and as you know, I've been serving for the last month as acting director of our housing and community action programs. Presenting a small portion of our presentation today will be Ms. Laura Birch, our director of our Health and Human Services Agency. So I've asked her to provide some information later on in the presentation. The purpose of our presentation here today is that staff would like to discuss with the board the housing and the homelessness assistance programs that we're able to provide as a county to our community. And after taking a look at what we currently provide, we'd like to go into a discussion on some opportunities that staff have identified and would like the board to consider regarding how we can potentially improve and streamline some of these services. With that being said, I do just want to acknowledge that anytime we are looking at programs that we operate and work that our staff are doing, we want to acknowledge that there are people involved, there are employees involved, and important work involved that we may be talking about making adjustments to, and I don't take that lightly. So I just want to say that from the get-go, that I take that very seriously and I care very much for the work being done and the people that may be impacted by potential changes that are made, hopefully for the better. So with that being said, I'm going to start just by providing an overview of our housing programs and services that we provide in the County of Shasta. So you're going to see two different squares presented on the slide that represent two different teams that we're going to be talking about today. And the first is our Department of Housing and Community Action. So within our Department of Housing and Community Action, we operate the Shasta County Housing Authority, which serves our community by administering our housing choice vouchers, which you may have commonly heard referred to under Section 8. These are administered by our Shasta County Housing Authority under our Housing Department for unincorporated Shasta County, interestingly, as well as Siskiyou, Modoc, and Trinity counties. And the department also houses our Community Action Agency for the county, which serves for the purpose of reducing poverty in Shasta County. The Community Action Agency in Shasta County provides the mechanism to cover administrative and operational costs for staff. For example, staff who manage and monitor loans, as well as property rehabilitation projects. The Community Action Agency also operates as the lead agency to the NorCal Continuum of Care, which I know you are all familiar with. The Continuum of Care is a 7-county consortium in our region, which acts as the pass-through entity for grant funding to that whole greater region with a shared goal. The department is also the administrator for HMIS, which stands for Homeless Management Information System, which you also see referred to on the slide as coordinated entry, which is that coordinated data collection process we utilize to gather and track information about the services we're providing to individuals experiencing homelessness. The other team that we have to look at today is our housing team that is located under the umbrella of our Health and Human Services Agency. So the Shasta County Health and Human Services Agency has a housing team that is incorporated underneath their economic mobility branch with the goal of disrupting poverty and homelessness. An interesting thing to know about the HHSA housing programs is that they are paired with a more intense level of case management for clients who are in need of housing, and they're able to provide referrals to community resources, life skills training, and they have a strong focus on the intervention and the prevention piece of homelessness. Their programs are often specialized in terms of areas like serving senior citizens, medically fragile individuals, those with mental health concerns, domestic violence survivors, housing navigation for young adults exiting foster care, and much more. So as you can see on those two squares on the slide, there's some level of overlap between the two housing teams, and then there's also some areas of distinct differences where one team has maybe a specialization or an area of expertise that the other one does not. And what I would like to communicate about these two teams is that though they are two diverse teams covering a broad range of services, they both have the same goal of bringing housing to our community's most vulnerable populations. So this slide picture depicts what we're referring to as a cycle of services in our county. So this is a picture of a cycle of services that represents the work of both of these two teams. So for example, when it comes to outreach, both of these housing teams are going to be conducting that outreach work. When it comes to coordinated entry, our Health and Human Services Agency participates in the HMIS system, but our housing department is the lead administrator. When it comes to rapid rehousing, which would refer to like emergency shelter situations, more provided under our Health and Human Services Agency. Permanent supportive housing would be mainly operated under our housing department, largely based on referrals from our Health and Human Services Agency or from other places in our community. Homeownership programs through our housing department, and tenant-based rental assistance through our Housing and Community Action Agency with funding from our Health and Human Services Agency. So I've paired all of this together on one slide to show that though these are being operated through two different teams, this is the big picture of this whole cycle of services that we are working to offer our community. And when we pair them together like this, we're able to provide better oversight and support, leading to better outcomes for our community. It takes both of these teams together for us as a county to be able to provide this full spectrum of services pictured here, and we are working on identifying barriers in this cycle that exist when we consider these two teams separate from each other. So, in conversations and collaborative efforts that have been happening recently between the Housing Department, the Health and Human Services Agency, and the County Administrative Office, we have identified a number of areas that we see as opportunities where we can improve in what we're able to offer. First is the cycle of services that we offer to a client. So we would like to work on simplifying the process for our clients. As you can imagine, it can be confusing to know where to go for services in our county, especially if you have to go back and forth to multiple locations depending on the particular type of service that you are eligible for or that you're trying to access. We'd like an opportunity to easily refer within different programs, so that means between different housing programs depending on a person's situation, but also with other programs that a client may be eligible for. We all know that housing an individual is really only one piece of the puzzle usually, and there are other services we can provide at the county to make them more successful in the long run. So, for example, assistance with food or employment training or all of those different services, we'd like to be better about pairing those with our housing services. We'd like to provide stronger support from social workers and community health advocates, and ultimately expedite processes and reduce stress for clients seeking services. Next is unifying efforts to engage with our community. Obviously, in Shasta County, we have a finite number of landlords that we're able to work with, also a finite number of developers. So we want to make sure we're not getting into a situation where we have two different teams competing for the same landlords or the same resources. We also want to work on having multiple touch points in the community and opportunities to reach clients across programs. Our Health and Human Services Agency is going to have an edge in this area because they operate most of our other health and human services related programs, whereas our housing department would be at a disadvantage there because they don't have all of those same touch points with clients. We'd also like to streamline services and reduce duplication. So when we have two different teams working in a similar field, we often can have overlapping or duplicative plans. We end up with referrals between two different departments, often for the same clients. We can end up with duplicative efforts to conduct community surveys and outreach. Community surveys are very labor and time intensive on staff to collect reliable data and reach hard to reach populations. So we want to make sure we are not duplicating efforts to do that. We're also in a situation now where we may be faced with double HIPAA requirements and HIPAA compliance costs, that our Health and Human Services Agency is HIPAA compliant, but our housing department is not, and that impacts funding that we are working to receive. We also have a lot of funding going back and forth between the two departments. For example, our Health and Human Services Agency in this current fiscal year is funding positions in our housing department in the amount of $260,000. And lastly is we'd like to bolster the administrative support that our housing programs have. So when we talk about resources that are needed for our housing staff to be able to do their work, we look at our Health and Human Services Agency, which has an entire contracts team, an entire fiscal team, an entire administrative branch. They have a strong set of resources to be able to conduct those administrative functions to enable the caseworkers and the program staff to be able to do their work. And then when we contrast that with the housing department, especially what I've observed since I've been down there, is a lot of very competent and hardworking people who don't have the administrative support that they need to do their job, which makes it very difficult. Additional resources that the housing department needs that our Health and Human Services Agency has at their fingertips in most cases. Bolstering administrative support would also mean making it easier for tapping into existing resources without the department barrier, and as well as removing the barrier that exists by being under two distinct different directors. So the opportunity that staff would like to ask the board to consider today is joining these two housing teams together. As a greater county organization, we know that we take on efforts to serve our community by providing programs and services, in this case to address issues of housing and homelessness, and providing much needed support to members of our community. But we as a county have flexibility in how we structure our organization to be able to carry these things out. And over time, we all know that organizations change and grow. And I believe that it is important that we view the county as an organization, not only in terms of distinct departments, but in terms of a greater organization that has resources that we can leverage across the entire organization. So as we evaluate where we are today, we have two teams devoted to similar goals. Yes, in many cases, focusing on different areas of expertise, but often serving the same clients. And with this in mind, we feel we could consolidate efforts and believe these two teams would be stronger together, removing barriers for our clients and optimizing the finite services that we have to our most vulnerable population. We do have a housing authority that's operated by our housing department. Housing authorities across the state as well as across the nation differ in their structures and the practices and programs that they do. Each one is organized in a way that responds to the unique needs and priorities of the communities that they serve. So there are different models as we look across the country. So to that end, that's why we would like to discuss with the board this opportunity. And I would also like to note this is not a new idea. During my time with the county and working under 3 different CEOs, the question has come to the table under each of those. Why do we have the 2 teams? And is there an opportunity to streamline and improve through consolidation? What we needed was the right place for this team to land, and we needed an opportune time where we had people involved with the expertise and the willingness to lend their time and support to pull it off. And we believe we have those pieces in place at this time. If we would be moving forward with this recommendation and going through with the transition, our priorities as directors, myself as the acting housing director and Ms. Birch as the director of HHSA, our strategy would be to provide the highest level of support to all employees involved on both teams who would be experiencing change and maintaining the high quality of services that we provide to our community. So that's why I've asked Ms. Birch to come up at this point to speak to how she would envision this would look if this team were to come under her agency, and to discuss more about what the transition might entail.
Thank you, Mary.
Hello, board.
Good afternoon.
All right, so let me see if I can get this thing moving. All right, why under HHSA? Little known fact, you may not be aware, some of you, but I was the former housing director for Shasta County back in, I think it was 2017-18, left in December of 19. So I do have experience in this department, and Christy Coleman has 8 years experience in the Housing Authority and Community Action Agency before she kind of followed my path in the direction that I have led. So why HHSA? HHSA plays a central role in the coordination of countywide services and resources for people experiencing homelessness and housing insecurity. HHSA also, as Mary had mentioned, are members of the COC, which is the Continuum of Care. We enter data into the Coordinated Entry System. We enter data into the Homeless Management Information System, and we are partners in the point in time count with county housing every single year. In last year, HHSA served 298 homeless people or families. We also received and processed 707 referrals for that same population in 2022. HHSA has a robust fiscal department, as you're aware. Our branch director over administration is Megan Dorney, and we have a bank of auditors and analysts who process the $282 million that we receive through realignment and grant funding. So they are specialists. Also, HHSA has specialized programs to assist seniors with housing, the medically fragile individuals, those with mental health concerns, veterans, families, and also foster youth. Of the 298 that were served, they reported the following: 94 had mental health issues, 18 had drug and alcohol abuse issues, 83 had chronic medical health problems, 65 had physical disabilities. 57 individuals reported having 3 or more conditions, and 31 people were fleeing domestic violence. So as Mary mentioned, there's a variety of reasons why someone would be seeking assistance for housing and homelessness, and HHSA works in all of these capacities right now. HHSA has established relationships with landlords, reducing barriers for clients, transitioning staff and services. So one thing I want to mention when we talk about housing authorities, I did a bunch of research before this meeting, and there's over 100 housing authorities in California, over 3,000 in the nation. Within California, there's multiple structures. Some are JPAs between a city and a county. Some are hybrid, working within a city or a county under the supervision, like ours is a hybrid model, under a board of supervisors with county employees who do the work. Some are their own commission. There's a variety. In California, I was able to find Lake County, El Dorado County, San Diego County. They're all under HHSA. Now, there's a variety, and probably many more that are under cities, and you may not be aware that City of Redding also has a housing authority to serve those within the city limits. And each have their own vouchers. So in the City of Redding, they administer 1,700 vouchers, whereas in Shasta County, in our housing authority, we administer a little over 1,100 vouchers to those within the county area, and Anderson and City of Shasta Lake. Anyway, with regards to the transition of staff, beside having expertise in the area myself, which would help provide some continuity and stability, HHSA has 39 staff right now in the housing and homeless services area. The Housing Authority and Community Action Agency have 21 staff who do similar work. So we would provide immediate supervision, stability, support to staff. Christy and I have 10 years combined experience in the housing department. We would review the contractual needs and redevelopment to assist programs in gaining the needed support fiscally and programmatically. We have contract teams that are skilled and able to help, and I believe they're already assisting as of a couple weeks ago, the Housing Authority right now with some of their contracts. We have updated policies and procedures that reduce silos, and we have the ability to cross-train this group of housing staff so they can increase their knowledge in the housing cycle as Mary described. The teams we would attempt to co-locate the teams to create a unified division and familiarity within the programs. Clients are commonly shared clients, and at some point, they all gain housing services. Being able to gain housing services in a central location is a benefit to our community. When I was in housing, there were many, many times that people would come to our housing department and we would have to refer them back over to Breslauer or vice versa, which is extremely frustrating for people who are seeking those services. There's also continuity for current housing projects. So Shasta County Housing and Community Action have about maybe five housing projects, 2 of which Christy and I started many years ago, which is Burning Commons and the Veterans Village Project in the city of Shasta Lake. We were involved in the very inception of those, and they are still going. They're still not completed, but these things take some time, but we have familiarity with those projects and the use of project-based vouchers. for these projects. Fiscal considerations, which is probably pretty important to the board. Fiscal considerations are that fiscally, county housing maintains a multifaceted budget. It is quite complicated. I did the fiscal myself when I was the housing director. It's got a lot of ins and outs, multiple grants, starting at different times, going for multiple periods of time. It is a complicated budget. They would benefit from HHSA fiscal support. Currently, the CAO's office has been providing fiscal support for many months, I believe since June of 2022, causing a strain on county resources. HHSA has contract experts, as I stated. The governor's budget focuses on collaborative efforts to reduce homelessness. There's a lot of money that's going to be coming to both housing, I'd say departments, but ours is not a department. HHSA is a division within the agency. And the housing department, there will be a lot of funding that will be coming through housing, through the continuum, also directly to HHSA for the same purpose, for the same clientele or similar clientele at different stages in their housing insecurity journey. There would be benefits as savings on the teams. Right now, we've got vacancies in both teams. So I foresee that there would be some savings, staff savings, as both have vacancies and they're currently being held. There would be a cost savings for not having 2 directors, 2 fiscal units, 2 contract units, 2 receptions, 2 offices. So it's kind of an economies of scale sort of thing. And then talk about reducing barriers. We talked about this, but currently, you know, we're working together in coordinated entry, COC related items, but you know, how we administer versus how they administer, sometimes they're, you know, working in silos. That would be reduced if we brought the teams together. By joining together, we could be more efficient. As I mentioned, there would be cross-training of staff to increase client access to a variety of programs. So if they could not apply for, let's say, TBRA, which is a tenant-based rental assistance that's offered in county housing, there might be emergency rapid rehousing that HHSA would be able to take that same person, hand it over to the next cubicle, and they can work that. And so it would reduce time and remove barriers for our community who is in need of our services. The length of time to receive services also, where one housing source dries up, like you could have a 30-day motel voucher for someone who's living in a car with a child and their dogs. We might be able to get them in 30 days, wrap around services, and then be able to get them during that 30-day period signed up or eligible for tenant-based rental assistance, possibly. And so, you know, there's different sources along the way that are all time limited, and within one umbrella, you have access to know what those are. The teams could work together to ensure that we provide continuity in the services for our clients. I would say communication between the community partners and clients. It's very confusing to our community members and probably even to the NorCal COC, the Continuum of Care, which includes multiple nonprofits that work within the same community with this population for different pieces. And they may not know who does what. What does HHSA housing do versus Shasta County Housing Authority? We have those questions when I would be up in NorCal COC meetings. There's confusion about who provides what services, who administers the funds. You could have ESG in HHSA, you could also have ESG in another area. It's a sort of funding, and it can get very confusing for many people. I would say that right now, recently we've seen an increase of working families have come into this mix, who may actually be the ones that would receive more services from county housing, but they would also pair with HHSA. There's an increase in working families needing assistance with security deposits and first month's rent, so they might be able to get a voucher from Shasta County Housing Authority or Community Action, whereas we would be able to provide maybe the security deposit possibly even looking at landlord incentives to lease to these folks. These are not the only options, and Mary will talk a little bit more about it. We've talked quite a bit over the different alternatives that the board has. Certainly, and there's probably even more than what I'm going to describe, but an alternative is to keep the current housing authority and housing department in place, hire a director, and continue working as it has worked for many years. That is an option. Another option is to consider consolidating the Section 8 program with the City of Reading Housing Authority. We could have them administer vouchers on behalf of the county, and I've had conversations with the city, and they would be interested in that. City of Reading is a viable option for consolidating the housing authority portion of that department. They've been a high-performing housing authority for 20 years minus one during COVID. The city would be interested in having discussions if that would be of an interest to the board as well. Let's see, and then another option is we could split out Section 8 and the COC to the City of Reading. They have an interest in the continuum of care. That's a much larger discussion that we would want to have, but the continuum of care was originally administered by the city before I came into the housing authority, and then we took it over. We spent a significant amount of time and resources administering the COC for 7 counties. The Community Action Agency in the state, it's administered throughout multiple counties in many different ways. The purpose of community action is to reduce poverty. You can choose almost any program or any mechanism that you would want to come up with a way to reduce poverty in your community. It could pair with any program. It could be a standalone. It could be run by a nonprofit. Right now, it is run within the housing department, but it's actually separate. They're two separate. They have 2 separate boards. I was the executive director for the Community Action Agency board. Some of you may be on that board right now. Someone should be, because usually there's a board member or 2 as an alternate who would sit on that board. So those are some of the options. I'm not saying that it has to come to HHSA, but I'm saying that there are other options I think you should be aware of, and I do think that the greatest concern right now is continuity and stability, and we can offer that if you so choose. Otherwise, certainly there are other things that you could consider.
So as I mentioned earlier, there are multiple models for how a county can structure its housing authority, its community action agency. As Ms. Birch has identified, there are numerous alternatives the board could consider. I think I have made it clear what the county administrative office would request of the board and would support as the best opportunity in this scenario. I would also say that we have had conversations with the director of HUD, who has indicated to us, that, as I mentioned earlier, models can be structured differently by counties or cities based on the unique needs and priorities of the community that they serve. And after speaking with the director about this particular topic and the idea of a transition as a potential solution, both to meet the needs that we see in our community, as well as to meet that need for greater resources and support in our housing department, not only was HUD at the federal level supportive of this concept, but they reached back out to express willingness to enter into a technical assistance grant with our county to provide the technical assistance at no cost to us to support us through this transition, as well as offer any potential legal support that our county counsel's office may wish to draw on. And they have scheduled a meeting with us for later this week to see the outcome of what this board meeting was and how we will be proceeding. So, to be clear, today we are here to discuss with the board these options, to receive your comments and questions, as well as to listen to what anyone in the audience may wish to say. There's no specific action agendas of the board today, so we're looking for you to weigh the information we presented and then tell us how you would like to proceed. Then, as the slide indicates, we would move forward at that point, however the board directed. If we were making alterations to the structure of our Housing Authority and Community Action Agency, that would require specific actions of the board that are not agendized since we're just discussing today. We would bring those back in February for action if we were directed to do so by the board. We do need direction about our housing department. One way